I'm Dr. Fenton LeBeau. I'm an MD. I'm the co-founder and CEO of Molecular World Health. I started out in the world of preventative medicine, and I found that a lot of disorders and diseases that we're suffering are really addictive in origin. And so I trained at the University of Florida, my residency, with Dr. Mark Gold, who's considered the father of addiction medicine. And I got initially reintroduced to NAD with a person named Dr. Richard Medier, who's considered the founder of NAD in the United States, who's done some groundbreaking work for NAD for addictions. So in the addiction space, we really don't use the word cure. We see addiction disorders as a chronic relapsing disorder. But we've seen anecdotally and in the literature written up by Dr. Medier that many people are actually cured to the state that they get IV NAD for 10 days and then they no longer need anything other than boosters. I started looking at this molecule way back in 1979. And it came back into my life 2 years ago, and now I'm the co-founder and CEO of Molecular World Health. And every day we see new amazing things with pain, with cognitive clarity, with brain fog, with anxiety, depression, and even tinnitus, and various other different disorders. And it keeps me excited and it keeps me going. And we're very excited to work with HowScholarlyApp.com. And I think we're going to make some amazing changes in people's lives. We really believe that supplemental NAD should be given to everybody over 46 years old. Our idea is to have it a price that everybody can get it. And we're on a mission to do that. So that's sort of my background.
I love it. So let's start with what exactly is NAD?
So NAD is a molecule that exists in every cell of your body. It's a long name, nicotinamide adenine dinucleotide. It's a very important molecule not only for energy, but it's also an important molecule for things like chronic inflammation and cancer protection because it inhibits mutations. So it's really the foundational molecule for overall health and just energy in every cell.
Who would use NAD? Who could benefit from it?
Well, the thing is that after 46 years old, our NAD levels drop precipitously. As we get older, it drops, but at 46 years old, there's a significant drop. And when that occurs, problems begin with chronic inflammation, problems begin with cancer, and we see a correlation between those two. So there are two different types of people that we think could benefit tremendously from NAD. Pretty much anybody over 46 years old, we believe, should have supplemental NAD at some level. And so from a wellness standpoint, we think people that are interested in keeping fit, longevity, anti-aging, and also people who have chronic disabilities, we believe the literature supports there's benefit. So that would include anything that has to do with chronic inflammation. For example, heart disease.
And what about for a young person like myself?
Well, since you're a top equine athlete, I think it would be very beneficial from a training standpoint. Before competition, we've had people do it before athletic performances, and they benefit tremendously. We're involved with various different professional sports teams. Anybody that's under 46 years old that's interested in being the best they can be athletically or just fit or cognitively, I think it's super fantastic.
Amazing. And is there anybody that should steer clear of it?
That's a very good question. So what you're really asking from a medical standpoint is there any contraindications? So the contraindications are interesting because it also speaks to the benefit of it. So one of the benefits of NAD is it revs up your immune system, and certain white cells are protective against infectious agents and also protective against cancer, because what they do is they run around the body, so to speak, and they identify anything that would be foreign or considered foreign. So, for example, a contraindication would be recent organ transplant or recent skin graft, because the immune system will identify that as foreign, especially revved up with NAD, and could attack that. Also, just to be super safe, we recommend people that are pregnant not to take NAD. Also, a person that's having active Lyme disease, because the Lyme infectious agent is one of the very few sources that require NAD as fuel. So that could stimulate a Lyme disease disorder if it was active. If it's not in an active state, most likely be very beneficial. And the other thing is, we wouldn't recommend a person that had atrial fibrillation, which is a kind of a heart arrhythmia, to take IV NAD, because one of the aspects of IV NAD is a metabolite called adenosine, and adenosine would be contraindicated for atrial fibrillation. Really, that's about the only thing that we would consider contraindicated.
I've been seeing all over my TikTok account, all over my social media, all sorts of stuff about NAD. There are pills, there's different companies. Can you talk a little bit about what you do, why your NAD is unique, and what should I think when I see this like $5 bottle of pills that says NAD on it, but I'm not convinced.
Well, we don't really want to bash anybody that's selling NAD products, but you have to be very careful. We do IV NAD, subcutaneous NAD, nasal spray, and topical. And so you see what's poignant there is what is not being offered, and that is oral. So we'd love to be able to offer an oral NAD, but it's impossible simply because the NAD molecule is very large. And if it's into the stomach, the acid will destroy it. So what we do is we do all the delivery systems other than oral, and we've nanoed it. So we have a patent pending on nano NAD, which means we've made it very small. And the purpose of that is to increase what's called bioavailability. We can get a much stronger dose in the solution. So, for example, we can have 400 milligrams, which is like an extra strength nasal or a topical. And also, because we've made it smaller, we see an increase in strength, effectivity, and benefit. So what we would do is we would always caution people to look at the science behind the NAD product they have, ask where it's being sourced, because it's very important to be careful about any nutritional supplement or anything you're putting in your body, and not really use price as your consideration.
What advice would you give people who are kind of interested in learning more, interested in getting more information? What should they be looking out for? What are the things that look good? Where can they get your NAD?
Well, they can get our NAD on molecularworldhealth.com. They can get it at nanonad.com. What they should be looking out for, as I said, just purity. If they're going to an NAD center, they should really be looking at the professional expertise in the center. We take a very medically based model because we take healthcare very seriously. I was trained in a very traditional medical track. Functional medicine is a very important thing going forward, and we believe in the principles of that. I'd recommend everybody just take a look at the facility they're going to and make sure that there's a medical director that's an MD or a DO, or be very careful of the ingredients, look at the website, and just see that you're staying safe, because, as we say, first do no harm. And so that's really our direction.
So talk to me a little bit about the disorders that you would use NAD to treat.
So first, we certainly we cannot make specific claims because it's not a registered drug, but what we can say is that NAD, being the number one anti-inflammatory molecule, we can make some correlative recommendations regarding what disorders would benefit. And those could be the neurodegenerative disorders, various different types of dementias, MS, Parkinson's, because all of these have tremendous inflammatory origins shown in the literature. One of our important scientists, a man named Dr. Ross Grant, has written an article showing that the various types of MS have a decreased NAD in the patients. We also know that NAD is very involved with keeping the mitochondria healthy. And so mitochondrial disorders, which really come down to metabolic disorders, which comes down to things like metabolic syndrome, and it comes down to diabetes and heart disease, as well as weight problems, all really come down to a healthy metabolism, which comes down to a healthy mitochondria, and NAD is very important in that. So these types of disorders are very amenable.